Good day. This is evidence-based practice to assignment entitled Standardized Nursing Communication Initiatives, NURS 830. My name is Dr. Glendy Pascal, and I am from Penn State University. Special thanks to Dr. Zhao for her patience, kindness, unceasing responsiveness, and the Penn State University faculty, the PSU students and cohorts, my family, and my loved ones. My area of interest has always been at the forefront of quality and experience. The benefit of being in the DNP program is grounded in establishing a culture of quality in nursing practice, determining and prioritizing potential areas of improvement, and sharing lessons learned with my instructors, my peers, and my mentors like Dr. Zhao to support wide-scale rapid improvement that benefits all patients and the healthcare organization as a whole. The purpose of this evidence-based paper is to synthesize the available research literature about the effect of communication initiative in improving the HCAHPS composite score, or we call that the Hospital Consumer Assessment of Healthcare Providers and System, or we call that the Patient Satisfaction Score. This paper will examine whether the intervention will increase the nursing communication score. My PICO question: in the inpatient hospital setting, what is the effect of communication initiative compared with no initiative in improving nursing communication HCAHPS composite score on a given 3-month period? After completing the literature research on CINAHL and PubMed, 5 articles were selected. They were selected based on their relevance to the PICO question, quality, and level of evidence. The first article found is a quantitative study titled Impacting Patients' Experience in a Children's Hospital Using a Communication Bundle Strategy. This study highlighted standardized communication initiatives that directly correlate to increased nursing communication scores. Second, it's a quantitative study titled Nurse Knowledge Exchange Plus Human-Centered Implementation for Spread and Sustainability, highlighted the human-centered implementation approach that links change management strategies and human-centered design that evolved the culture of professional nursing practice related to shift reports. I'm part of this study because I was in Southern California during that time. Third, it's also a quantitative study. It's titled Quantifying Patient Satisfaction with Process Metrics. Using a weighted bundle approach, identify the variables and types of relationships that provided perspectives on fit, feasibility, and appropriateness of recommendations for translation path. The fourth article is a quantitative study titled The Effects of a Hybrid Training Program Improving Nursing Communication Skills and HCAHPS Scores, highlighted the impact of nurses' knowledge of evidence-based patient communication strategies on nursing communication scores. Finally, it's another quantitative in nature, was entitled Effects of Multi-Method Intervention on Bedside Report Compliance and Patient Satisfaction Score. This correlated the level of evidence of bedside ship report adherence to increased patient satisfaction scores. Overview of each article. All these articles use a survey research, non-experimental, quantitative design. The first article examines whether a communication bundle would improve the listening and explaining components of nursing communication. The results show that the unit's listening and explaining nursing communication scores exceeded the 75th percentile benchmark. Second, it explores the effects of NKE+, which is a hand-of model in improving nursing communication HCAHPS scores. After more than 3 years, the scores improve from 73.1 to 76.4 mid-score percentage. Third, the study aimed to examine the effects of a process-driven bundle improving the likelihood to recommend scores, which is one of the domains of HCAHPS. The results, their press gain scores, which is their vendor, their survey vendor, increased from 64.73% to 74.64%. Fourth, the purpose is to study or examine the effects of a hybrid training program in improving nursing communication scores. The results, 5 HCAHPS composite scores improved post-implementation. And then the last one, the study evaluated the effectiveness of a multi-method strategy and its effect on bedside ship reports. The scores improved from 69.9 to 73.8%. 2 years after the implementation of the program. Comparison of the findings. Nursing communication, as we all know, is foundational. Strong correlations with other HCAPS composite indicate a likelihood that focusing on nursing communication will improve performance across several other HCAPS STAR measures. To compare, quality improvement initiatives that use hybrid and multi-method approach improve their patient satisfaction scores 5 to 9 mean percentage score higher than those that use one care experience strategy. Of the 5 articles designed to improve nursing communication HCAP scores, 3 reported a significant increase using a multi-method communication strategies. Notably, all interventions in included studies initiated a bedside shift report and a standardized rounding protocol. Moreover, we cannot delineate the fact that culture and engagement is important. Culture and engagement index vary widely across organizations. As such, some authors propose aligning culture and engagement interventions in the implementation of patient satisfaction initiatives to promote optimization of approaches to achieve better outcomes. This is just a simple synopsis of what I'm talking about in terms of the goal of the studies, the drivers, and the respective actions. Overall finding, the overall approach relied on the ability to build accountability in every specific and concise goals. Strategic measures on how screening of variances would have an effect on tasks, behavior structure, and people. The most important thing here is effective implementation of the change was enhanced when the people being asked to modify their behavior and skill sets were allowed to participate in designing the change program. We should always involve our stakeholders so that we could foster ownership and accountability. We should always explain and connect the what to the why to the how, or the how to the what to the why, either or. The issues surrounding nursing communication have revolved around the 5S problems, and that is structure, standards, support, spread, and sustainability. Why is nursing communication important? Number 1, because of the shifting reimbursement system. Number 2, as we discussed a while ago, it has the strongest correlation with most of the HCAPS domains. And finally, it is the right thing to do for the patients, for the families, and all our stakeholders. Another recommendation is further studies implementing an organized and a standardized bundle of approaches regarding nursing communication initiatives from admission until transition of care are needed to complete the care experience journey. We should also focus on other research designs as longitudinal, meta-analysis, and systemic studies so that we could examine how to sustain the changes and how to spread the best practices. Additional studies need to be conducted on how to integrate the multi-level discharge process in the care experience. Another aspect that needs further study is the staff and patient's perspective of the use of training programs to enhance behavior standards and caring behaviors. You cannot achieve success, as what the articles have emphasized, without an enhanced behavior standards and without emphasizing the caring behaviors. Both quantitative and qualitative studies on the use of hybrid training programs would further support the quality improvement projects. These are the signature initiatives that were highlighted in the studies. Conclusion, evidence showed that effective communication between the nurse and patient is pivotal to relieving anxiety, cultivating trust, building mutual relationships, and offering opportunities to influence the current situation surrounding the care experience journey. Nursing communication is a vital cornerstone to patient safety, patient satisfaction, quality of care, and a trusting environment of care. A bundling single interventions together into a package of associated tactical elements or key elements that providers of care must follow every patient, every time. Finally, communication makes up a culture in a unit. The leadership style of a leader, the collaborative or toxic way members of a team coordinate their efforts. As such, communication issues can be understood as the root of the most important problems we face in our current nursing profession. Research and solutions to the challenges therefore must focus on communication if we hope to find real solutions that get at the source of our problems in nearly every aspect of what we do as nurses. This is how success would look like if we follow what the articles have suggested. Lessons learned, again, stakeholder involvement is very important, and staff should understand the rationale for doing the program. These are the 5 references that I included in this assignments. Again, I always believe that service is everyone's accountability. Dr. Jiao, special thanks to all your efforts, and hope to see you sometime soon. Thank you.